Answer therapy uses a massage format, but you keep your clothes on, you lie facing up only with a blanket over you, with your eyes open. There's no music playing and there's little or no touch involved. All that sounds familiar. The rest of the method is new, because answer therapy is a new form of medicine. Chiropractic, acupuncture, and massage are all different forms of medicine, which means their procedures are different. There's no crossover between massage and acupuncture, for example. But they all have the same goal of relaxation when used for chronic musculoskeletal pain. Answer therapy is another form of medicine with the same goal of relaxation. So why would you do it? Because the effect on your nervous system is unique. The effect is actual healing that eliminates chronic pain. We actually have hundreds of relaxation methods. All of them have applications for pain relief because relaxation counteracts the stress response that causes pain. How could answer therapy be unique with unique results? In almost every relaxation method, the first thing you do is close your eyes. When you close your eyes, you go into an altered state where you're partly disconnected from your feelings and your surroundings. It's very easy to achieve deep relaxation in that altered state. Obviously, there are benefits to that type of relaxation. However, your nervous system cannot access critical healing responses in that disconnected state. What you need is to be wide awake and present and have deep relaxation at the same time. That gives you a unique state of relaxation that I call absolute comfort. You don't check out and go numb to your discomforts, which means unmet emotional needs. Instead, you're awake and you feel your discomfort, and you feel when discomfort is converted to comfort. The result is profound relaxation that maximizes your healing capacity. With answer therapy, you remain wide awake with your eyes open in a brightly lit room. There's no music, no fragrances, nothing that would pull you into a disconnected state. But what does answer therapy look like? Usually when people ask about my method, they're looking for a familiar term, like massage or energy work, so they can dismiss answer therapy as just another one of those, a recycled method. But there are no familiar terms to describe a new form of medicine. It's never been done before, and it triggers healing responses that no one has seen before. You cannot do the same old thing, or even a variation of the same old thing, and get radical new results. You need totally new procedures not found in any other medical method. In other words, you should not expect a new form of medicine to resemble anything else. Another problem people have when they hear about answer therapy is that they assume that a pain relief method must involve manipulation because they've never seen anything else. Like I said, you need relaxation to counteract the stress response that causes pain. But you don't need manipulation of any kind to get relaxation. You also don't need hypnosis, guided visualization, or what people call energy work, which means manipulation of bioelectricity. That's a type of anatomical manipulation. I trained in several methods of energy work and several massage methods. I also reinvented psychotherapy using the same science behind answer therapy. I'm basically a jack of all therapies. I've had clients who thought I was a Reiki master even though I never learned Reiki. I can move through a wide spectrum of therapies. However, when I'm working with chronic pain, I use answer therapy. I don't use manipulation, which means diddling with your body from the outside. Answer therapy mobilizes healing responses from inside your body. The key to accessing that healing potential is absolute comfort. So, if you want to understand the answer method, you need to realize that it requires actual learning, as opposed to word recognition. There's nothing familiar about it. You should not make assumptions about it. The medical theory is very simple. I talk about the medical theory in Part 5. The secret of answer therapy is the process of achieving absolute comfort. That requires a new science that does not exist outside my practice. In Part 1, I mentioned the conversion of discomfort to comfort. That process is best explained in terms of behavior. But we need a more technical, more useful understanding of behavior than what we have currently in psychology. This is a quick introduction to my new behavior science. Any serious study must begin with a clear definition of the subject. In this case, behavior. What is behavior? Psychological science does not know what behavior is. They know what it does, but not what it is. For that reason, they cannot fully explain dysfunctional behavior, healthy behavior, emotional needs, anxiety, addiction, codependency, etc. Things that require a technical definition of behavior. So, behavior is expression of an organism function that changes your emotional state, as opposed to a vegetative function that does not immediately change your emotional state, such as digestion. Behavior determines your emotional state. Every moment of life is occupied by some type of behavior. Even when you're sleeping, that's behavior. What else would it be? You're doing something. That means behavior. If you look at every activity in life, you'll notice that all those different behaviors can be categorized. I count 9 categories of related behaviors. Each category is a single behavior function. For example, we perform many kinds of work every day. Food preparation, childcare, travel, earning money, etc. Those are all separate aspects of the work function, one of 9 functions. If you study each behavior function, you'll notice that each one is intended for success. We don't have a natural function for self-destruction. The human organism is made to be successful with everything. All behavior is either effective or ineffective. That means every little thing you do in life serves your active behavior function effectively or ineffectively. Effective behavior is healthy. Chronically ineffective behavior does not effectively serve the active behavior function. That's dysfunctional behavior. The function itself is neutral, something you want or need to do. It's the expression of that function that's either healthy or dysfunctional. Now, what are the effects of effective versus ineffective behavior? All behavior determines your emotional state. Does healthy behavior feel bad? No, it makes you feel somehow good. The automatic results of healthy behavior are comfort, self-esteem, empowerment, real spirituality, happiness. When you have healthy behavior between 2 or more people, you get self-esteem in each person, trust, peace, understanding, integrity, and so forth. Everything good in life comes from healthy behavior. You also get biological relaxation in the autonomic nervous system. Just like the emotion of comfort, relaxation is an automatic result of healthy behavior. Anytime someone uses a behavior method, they see benefits only when they experience healthy, effective behavior. The reason people use behavior methods is to experience actual health. If they're not experiencing health, they're wasting their time and money. Now think about the psychotherapy industry, where we have a very high failure rate and a very high burnout rate for practitioners. Why? They don't know what behavior is. So they don't know what healthy behavior is or how to get it predictably. If practitioners understood the mechanics of creating health, clients would have healthy behavior every minute of every treatment. No failures, no burnout. So if the effect of healthy behavior is emotional comfort and biological relaxation, what's the effect of dysfunctional behavior? Dysfunctional behavior is an ineffective attempt to do something healthy. Again, each behavior function is designed for healthy expression. So when someone needs their ineffective behavior, that behavior serves a purpose. It provokes emotional discomfort and also a stress response in the autonomic nervous system. Healthy behavior cannot serve the purpose of dysfunctional behavior because health leads to good feelings. Someone who needs dysfunction needs to feel bad. Why? Because chronic discomfort and stress serve the purpose of repressing emotional trauma, which means preventing contact with intolerable emotions. Every modern person has some repressed emotional trauma due to abuse and neglect starting in childhood. There's very little support for health in the modern world. The good news is that ineffective behavior can be converted to effective behavior, automatically and predictably. The same behavior function is expressed by both behaviors. When you support healthy behavior with proper procedures, the active behavior function will switch involuntarily from ineffective to effective expression. That's an instantaneous, involuntary response to adequate support. I call that spontaneous conversion of the active behavior function. The organism will drop its dysfunctional behavior on the spot and switch to healthy behavior. That's what happens any time that anyone improves their behavior. It happens every day in small ways. But no one knows about this conversion process because they don't see it happen often enough. Why not? Because they don't support healthy behavior enough. They don't know what the 9 functions are or how to support each function properly. You need to see that conversion enough times before you see the pattern. Now, why would the human organism involuntarily drop its dysfunctional behavior and switch to healthy behavior? Because behavior is a body system, like your immune system or digestive system. Every system responds involuntarily to supportive conditions, including the behavior system. My behavior model is called the Behavior System Model of Human Functioning. Our first priority in life is to sustain life. We do that by healing pathology, any chance we get. So the moment your behavior system senses real support for health, it drops that pathology and grabs onto health, even if it never experienced healthy behavior before. Health is our natural design, human nature. Dysfunction, destruction, and misery are not human nature, and I can prove it by supporting health. We go back to our default setting of health and happiness when conditions allow. The trick is to provide adequate support. If support is adequate, the behavior system cannot resist that switch to healthy behavior. If support is inadequate, the behavior system says, forget it. I'm sticking with my dysfunction because I don't have enough reason to leave my familiar territory, even though I'm totally miserable. And the more severe someone's dysfunction is, the more support they need to shift into health. It's relatively easy to provide support in a controlled therapeutic relationship. It's not so easy to provide support in the real world of uncontrolled settings and crazy relationships. That's why I call it the science of eliciting healthy behavior. It's what psychology should be. That one principle of spontaneous conversion is enormously significant for the future of civilization. All the problems in the world are caused by dysfunctional behavior, including climate change. All that dysfunction can be converted to health if people receive adequate support for healthy behavior. Obviously, that's never been done before. But that's what we need to do if we want civilization and our biosphere to survive the years ahead. If we're ever going to have world peace, health, happiness, and harmony with nature, we need to eliminate dysfunction from planet Earth. But we need to know how to do that. We need to understand the mechanics of spontaneous conversion, how to create health predictably. When the science of eliciting healthy behavior is applied to medicine, it becomes the science of eliciting comfort, making people comfortable for medical benefits. The emotion of comfort is an automatic result of healthy behavior, which means that comfort indicates that healthy behavior has been achieved. Your overall experience of comfort indicates that your behavior is healthy in that moment. We have 9 behavior functions. We switch constantly from one to the other. Each one is attempting healthy behavior, either effectively or ineffectively. For the most comfort and the most medical benefit, you want all the client's behavior to be effective. That means you need to support as many behavior functions as possible in real time, as they become active. Now, what does it mean to have an active behavior function? Again, a behavior function is something you want or need to do. So, when one of them becomes active, you have an impulse to do something. That's the technical definition of emotional need, an impulse to take action. The action might be covert, like thinking, or overt action, like talking. To satisfy an emotional need, you need conditions that support effective expression of that behavior impulse. If you don't have the right conditions, you don't get effective behavior. Impulses will be blocked from effective expression. That's what causes the emotion we call anxiety, when an impulse is blocked from expression. When you receive support for healthy behavior, the block disappears and the impulse is expressed effectively. The impulse uses that support for effective expression. Your anxiety is relieved because the block is gone. There are 4 basic types of blocks, but that's too much to talk about here. On the other hand, dysfunctional behavior also relieves anxiety because it expresses the same impulses. But with dysfunctional behavior, the impulse breaks through the block in the absence of support, purely for the purpose of relieving intolerable anxiety. That's why we have dysfunctional behavior, because it relieves anxiety. However, it does not give us comfort or any other good feelings because it's not effective behavior. It does not satisfy any emotional need. It produces a stress response that numbs your feelings in general. Even when you have intense emotional acrobatics happening, the deeper, intolerable feelings are numbed. At the same time, you also numb the good feelings, like love and empathy. Some supportive conditions are supposed to be internal, such as a capacity for human connection. If you lack your own internal support, some of your behavior will be ineffective. The purpose of a behavior practitioner is to compensate for a lack of internal support by providing external support. Then the client is able to shift involuntarily to healthy behavior, which produces comfort. If the practitioner has enough knowledge and expertise, they can provide comprehensive support for each of the 9 behavior functions, if or when they become active. That's when profound comfort becomes a predictable event, because all the client's behavior will be effective. I call that holistic behavior support, comprehensive support for all 9 functions. It's essential for answer therapy because everyone has little habits of ineffective behavior, such as mental chatter, that maintain a continuous undercurrent of stress. You cannot access nervous system self-regulation in that state of stress. You need your behavior to be effective to get the comfort that neutralizes that stress. Aside from my psychotherapy method, answer therapy is the only method that provides holistic behavior support. To put this into perspective, let's say you go to a clinical psychologist who's been practicing for 50 years. They won't know what the 9 functions are or how to support them when they become active, which means you have unmet emotional needs. In other words, they won't see that you have impulses that could be converted to health on the spot. That means they cannot give you healthy behavior every minute of every treatment. They will give you some behavior support, but they won't compensate entirely for your lack of internal support. That means you will never make the progress that every person is capable of making. To summarize, in a therapeutic relationship, your level of comfort is a measure of your behavior efficacy, which in turn is a measure of the support you receive from the practitioner. The phenomenon of absolute comfort is made possible by holistic behavior support. It means an unprecedented level of comfort with major medical applications. Why is comfort so relevant? Profound comfort tells you that your autonomic nervous system has returned to a natural state, with full healing capacity. Your nervous system is the interface between behavior and every other system in the body. You know you're helping your physical health when you have that subjective experience of comfort. We can use this comfort theory to analyze any behavior method. For example, conventional massage therapy supports 3 behavior functions. Those are physical comfort, enjoyment, and human contact. Massage is mostly behavior medicine. You rest on a massage table while receiving enjoyable touch that gives you human contact. Your behavior system uses those conditions to satisfy its impulses to get those 3 things. Use of supportive conditions is a behavior response with effective behavior. Even though you're not moving or talking, your organism is doing something. That means behavior. However, massage methods don't provide support for most of the 9 behavior functions, because the therapist is busy following standardized procedures. That means massage therapy is mechanically limited in the amount of comfort it can provide. And if the practitioner is having a bad day, and their behavior support is inadequate, you actually might have more stress after that massage, even if the procedures are technically correct. For example, try getting a massage from a therapist with cold, wet hands. It's like being rubbed with a fish. That does not satisfy your need for enjoyment or human contact. And you cannot appreciate resting on a nice table because you have an overwhelming need to get away. That's a different behavior function, and it's blocked, which gives you anxiety. In this case, the fact that you're getting massage procedures means nothing. You don't get comfort or relaxation because the active ingredients of massage are missing. It's the quality of touch that either meets or fails to meet your needs. Again, answer therapy supports all 9 behavior functions. Holistic behavior support. That means every detail of the method is relaxing. But to do that, I cannot have standardized procedures. I cannot be following instructions because I need to pay attention to the client's emotional needs. Their needs can change a few times per minute in ways that they don't notice. It's my job to notice the client's needs and provide supportive conditions, even though we just met and they don't know what they need. How often do you feel stressed, but you don't know what conditions you need? Everyone has unmet emotional needs. That's a fact of life in modern society. But since I recognize basic needs, and I've been doing this since 1992, absolute comfort is a predictable event in answer therapy. But wait a minute, is answer therapy a psychotherapy method? No. You cannot cross the line between psychotherapy and relaxation therapy. That would deprive one of your 9 functions. That would cause discomfort, which means a stress response. Anything stressful freezes your nervous system healing process. If you have chronic pain, you need absolute comfort. I can provide infinitely more support with my psychotherapy method, but many of those procedures are inappropriate for a relaxation method. So how do you work with behavior in a relaxation method? Most of the time during an answer treatment, you would never guess we're working with behavior. We don't talk about emotional problems, but you're more comfortable than you get with any other method. That means your emotional needs are being met every minute of every treatment. How do we make sense of this? Each of the 9 functions is a separate type of awareness. It's keenly aware of the presence or absence of support. Each one responds involuntarily. Involuntary means no conscious awareness is required. That means no talking is required. Conscious awareness, which we call the mind, is one aspect of one of 9 functions. You don't need conscious awareness to get healthy, effective behavior. That's a big, big misunderstanding in the psychotherapy industry, which revolves around conscious awareness of everything. Medically speaking, you don't need conscious awareness to get absolute comfort. That's why answer therapy is a pure behavior method. But it's not psychotherapy because we don't talk about your problems or your emotions. For example, most people are nervous when they come for their first answer treatment. That's not a problem. It's normal. Nervousness means their safety function is active at that moment. It's actively seeking conditions that support effective safety behavior. The client is not aware that they need to feel safe, and they don't need to be aware. We don't talk about it at all. But I'm aware that the client is nervous, so I simply give them a blanket. Suddenly, they're no longer nervous. What happened? The blanket is a safety procedure. It's a condition that supports effective safety behavior. The safety function uses that blanket to obtain safety. That's a behavior response with involuntary healthy behavior. The client is not moving, which means it's a covert behavior response. We don't talk about it because no conscious awareness is needed. The safety function has its own awareness, separate from conscious awareness. It senses the supportive condition and automatically uses that support. The automatic effects are comfort and biological relaxation. The blanket procedure for the safety function is an easy example. What about the other 8 functions? How do we support those? Some of them are too complex to talk about here, but each one has mundane aspects like walking and talking, things we recognize as behavior. And each one has esoteric aspects that sound mysterious. But they're all aspects of the same 9 functions. For example, one of the 9 functions is the separation function, which has many aspects, including personal boundaries, privacy, detachment, possession of personal belongings, ending a conversation, etc. All those aspects involve separation. The fact that we have a separation function is not common knowledge. Therefore, almost no one knows how to support their own or someone else's separation function. Most answer therapy clients arrive at the office with an active separation function. They're trying to separate from stressful situations elsewhere, but they don't know how to do that. So they're stressed out, spinning their wheels with ineffective separation behavior, which makes them feel worse. You cannot access nervous system self-regulation in that state of stress. You need effective separation, which gives you comfort. During an answer treatment, I'm aware that my client needs to separate from irritating things at home. I'm also aware they need to feel that their personal space will not be invaded, which you've already experienced in countless situations. My clients need detachment and personal boundaries, but they don't know how to make those things happen. How do we support their separation function? We don't talk about boundaries at all. I don't lead them through a guided visualization, and I don't wave my hands around in the air. Instead, I put my attention on their boundaries. The separation function has its own awareness that does not involve conscious awareness. It uses my attention to manifest real boundaries, maybe for the first time in that client's life. A personal boundary is a concrete phenomenon. It's not an abstract psychobabble concept, but it's esoteric behavior. If you cannot see what I see during an answer treatment, it looks like nothing is happening. But the client would say they feel relieved or peaceful or powerful, any of which indicates effective separation and comfort. They have no idea what happened or why they feel so much better. All they notice is comfort. Here's another example. The one behavior function I support most often is contact, which is also called emotional connection with yourself or others. Normally, we connect with others through eye contact, conversation, or touch. Those are familiar, mundane aspects of the contact function. But in answer therapy, we're not having eye contact. We might not be talking about anything, and I use very little touch, sometimes none at all. And yet, the client feels a deep satisfaction from human contact. Why? Because the whole organism is keenly aware of attention from another person, and it automatically uses that attention to satisfy its need for connection. Conscious awareness is another aspect of the contact function. But you don't need conscious awareness to satisfy your need for human contact. That's why you could be asleep during a massage, but your behavior system is totally aware of receiving contact through touch. When I do use touch, it's when the client needs connection through touch, usually in spots with pain. But I leave out the anatomical manipulation of massage. In other words, I extract the active ingredient from massage and then I concentrate it. I magnify the benefit, but without the energy drain that plagues bodywork practitioners. But it gets even more mysterious. If you have my skill set, you can connect with spots of pathology inside the client's body. Anytime there's a spot of pathology, it will have a localized, severe stress response. It may or may not cause pain. That pathology might be a tumor, infection, muscle spasm, subluxation, kidney stone, etc. If you can see that stress response, you can connect with it, which relaxes that area. Relaxation activates healing responses in different body systems, especially the immune system. That's also how I work with infants with early life trauma. I connect with that stress response in the central nervous system, mainly the brain. The infant's behavior system converts that trauma to emotion for emotional discharge, which erases the memory of trauma. Then the client can relax and function normally. I can also do that for adults with PTSD, but not with answer therapy. The takeaway here is that human behavior is very complex and often very subtle. Every example gets more mysterious and takes us farther down the rabbit hole of esoteric behavior science. But it's good to know that there are mechanical explanations for mysterious events in medicine, relationships, etc. Many answers lie in the esoteric aspects of behavior. If anyone doubts the reality of esoteric behavior, look at the answer method and the results. In the method, it looks like nothing is happening. But the results show that answer therapy outperforms every other method. That means it hits the nail on the head with the right support for pain elimination. That's proof that my behavior science is valid. However, answer therapy is just one of a million applications for my behavior model. The same model encompasses mundane and esoteric behavior. It explains how health can be created in every context, including medicine, education, spirituality, government, foreign relations, etc. The same 9 functions are expressed in every situation, either effectively or ineffectively. Some people make a blanket statement about alternative medicine. They say it's all a placebo. The placebo effect is one aspect of one of 9 behavior functions. The imagery function, mental imagery. Mental imagery is so powerful that every new drug needs to be tested against a placebo to make sure that behavior is not responsible for the benefit. What we call mind-body medicine is usually support for mental imagery plus contact, connection with yourself. But there are 9 behavior functions, all of them equally powerful when properly supported. And most of them don't require the use of your mind. So I need to distinguish answer therapy from mind-body medicine because answer therapy supports all 9 functions. It's like mind-body medicine on steroids, and it goes way beyond the placebo effect. I actually don't work with the imagery function very often because I work mostly with chronic musculoskeletal pain. The other functions are more relevant. But sometimes I'll tell a client to picture their head floating in water to help relax their neck. Most people don't need that procedure. But sometimes your body needs a mental image. One time I had a friend who had severe neck pain because her cervical spine was out of alignment due to stress. I told her to picture a waterfall from her head down through her neck. Suddenly, she felt the bones in her neck move back to normal position. Spontaneous realignment. Her pain stopped, and she could move her head normally. That was interesting because she was sitting upright in a chair, and we were talking over Skype. But still, that was nervous system self-regulation. I had another memorable case in the 90s when a mental image was the right procedure. I had a massage client who'd had a plantar wart for several years. That's a painful wart that grows into the sole of your foot. And my amazing imagery procedure was, tell it to go away. And she did. That was the whole procedure, tell it to go away. The next time I saw her, a few weeks later, it was gone. No surgery, no bloody hole in her foot. What happened? She was already super comfortable during her treatment, which means she was receptive to a mental image. My procedure prompted her imagery function to choose its own mental image. You can do the same thing with medical hypnosis. First, you get comfortable by supporting the contact function. They call that hypnotic induction. Then, when you're receptive, they introduce the mental image. People have healed terminal illnesses just by supporting those two behavior functions. That's mind-body medicine. What would happen if you supported all 9? You may have heard of Dr. John Sarno. I share a video about Dr. Sarno on my website. He was famous for proving that people with debilitating back pain could heal their pain without getting spinal surgery, even when they had multiple herniated discs or spinal stenosis. His method consisted of an office visit to rule out the need for surgery, followed by a lecture, followed by relaxation exercises as needed. Many people healed their pain just by reading his books. Why was Dr. Sarno so effective? Placebo effect? No. He supported two behavior functions that were not usually supported by mind-body medicine: agreement and work. Dr. Sarno did not have my behavior model, but he knew exactly what people needed. If you watch the video on my website, you'll see other doctors attacking Dr. Sarno's method. Why? Because his method was beyond their learning capacity, even for a professor teaching medicine at Harvard University. In many ways, we're still in the dark ages with medicine, especially behavior medicine. For example, at some of the largest pain research centers in the world, they're studying cognitive behavioral therapy for pain management. That means basic contact procedures, kindergarten behavior science. Why are they spending millions of dollars on clinical trials for kindergarten behavior science? They don't understand the 9 behavior functions. And pain management does not want pain elimination. That's why they ignore answer therapy when I tell them about it. There's more money in management, which means repeat business for unnecessary suffering. This is a stage in the evolution of medicine. Why? Because chronic pain exists. Chronic pain should not exist. People are suffering unnecessarily for decades, making tons of money for the pain management industry. I invite you to step out of that industry and make the world a better place. If you'd like to learn more about behavior mechanics, I'm starting this YouTube channel for a much-needed public examination of dysfunction in the world today. what it is, how it operates mechanically, and what we can do to convert it to health. The word mechanics means predictable cause and effect relationships. You do this, you get this result. If you're looking for answers for why people do what they do, you're asking about behavior mechanics. If you study behavior mechanics, everything makes sense. In medicine, government, religion, etc. I guarantee you won't hear this information anywhere else. This video is a brief introduction to mechanical behavior science, the science of converting dysfunctional behavior to health. It's all new for professionals and for lay people who read psychology books. And there's much more depth to explore. If you'd like to be part of an ongoing discussion, go ahead and like this video, subscribe to my YouTube channel, and leave some questions in the comments section. We'll take it step by step, so hopefully everyone will understand the basic principles. See you next time.